Hello and welcome back to Chirohype. I'm Dr. Pflug. I practice at Pflug Family Chiropractic located in Springfield, Illinois. I'm very happy today because I get to speak with my good friend, Dr. Nicholas Murtland, and he's going to explain a little bit about himself.
I'm Dr. Nicholas Murtland. I practice in Westchester, Ohio. It's a little bit south of Dayton and a little bit north of Cincinnati. We're a family practice. We focus on mostly family care. We do a little bit of sports, and actually we do a lot of children and pregnancy care as well.
Interestingly enough, Dr. Murtland and I both have very young children. I have a 1 year old, Brock, and then Dr. Murtland has, how old is Nico?
He just turned 4 months last week.
4 months. That's awesome. And Brock just started walking,
So,
so
yeah.
go ahead.
No, go ahead. Go ahead.
Yeah, and Brock just started walking like last week, so that's been a lot of fun. I'm sure you're enjoying watching Nico develop and things like that.
Yeah, he just started the reaching out phase. Like I said, holding his bottle. I'm enjoying the time he can't move, and I got little nieces and nephews that I watch grow up, and when they can move is when it gets hard. So
No
I'm
kidding.
enjoying the time he sits where I sit him. So yeah, it's cool. But like I said, it's awesome watching them grow each day. They learn something different. Little personalities come out, so it's definitely a life changer. But it's been amazing.
And the personality, when the personality comes out, is so much fun because obviously, nurturing a baby, it has its pleasures too. But when you get to see that baby kind of release their personalities a little bit, it's so much fun.
Oh, absolutely, absolutely.
And then so today I wanted to talk about like what was so what was pregnancy like for you and Jade?
Pregnancy, I would say the first trimester was smooth. No morning sickness. She could basically eat whatever she wanted to, so it was good. Literally the first day, the second trimester, I mean, it was basically like on key that first day. The morning sickness came.
Wow.
And we tried a lot of things. A lot of foods upset her. So, I mean, of course, altering your diet is huge.
Right.
Why try to force it? I got to take my hat off to her. She would not take any medication. Wanted to do it the natural way. And like I said, I'm very proud of her for that. There was a couple of days where it was saltine crackers and a little bit of 7 Up, and that's what she could hold down. So that's like I said, she's very good there. Third trimester, I would say the morning sickness slowed down a little bit. The big thing was a lot of indigestion then.
Sure.
Which of course, the mid-back adjustments were huge. I mean, I would say in the third trimester, she's probably getting adjusted twice a week, and a little bit of soft tissue work in the neck too and low back, just because she was so out front and that low back was just on fire for her.
Right.
Other than that, I mean, pregnancy was super smooth. My job wasn't that hard. I was just kind of the coach at that point. But yeah, like I said, she did all the hard work and carrying.
Right, and I don't want to take too much credit for Tamara's pregnancy either. I think we had a pretty good time. I don't remember trimester by trimester exactly, but I remember when she did start to have she had a lot of morning sickness, and when she started to notice that, we looked into some, herbal remedies. I think we used some peppermint tea for a little bit, but like you said, just with her cravings and how she felt, we couldn't really nail down a good habit for her to help with things, the nausea and things like that. And then as far as the pregnancy goes, she was in a significant amount of pain at times. I know if you've ever dealt with a pregnant woman, they seem to be all over the place. 1 second they're fine, and then maybe 10 minutes later everything hurts. So Jade getting adjusted twice a week, I can certainly relate to that. Because when you live with these pregnant women, you're the one hearing all the complaints, and it's like,
Right.
on one side you're a chiropractor thinking, okay, what is this? What would I diagnose this as? I could probably certainly treat this. And then on the other side, you're just like, starting to get probably a little aggravated, and maybe
Right.
not.
Right. No, no, absolutely. And that's the thing too is you were talking about the peppermint oil. We noticed, I want to say it was in the second trimester, that if she didn't wake up with morning sickness. We had some essential oil that I believe was peppermint. It might have been mixed with something else.
Sure.
She wasn't sick in the morning, and she started feeling it once she got up. The peppermint oil would work. But if she was already feeling sick when she got up, it wouldn't work. But like I said, the wouldn't even call it the emotional swings, but it's, I mean, depending on what position he was in, I mean, it was hurting her back. And that's, like I said, being the husband, the father, you try to just try to accommodate for that. But then you put on your chiropractor hat and you're kind of like, well, let's see what we can do about this. And there was times that best thing to do was just let her be. I mean, she was in so much pain in that low back that it wasn't worth touching her. It wasn't worth trying to get some movement or even soft tissue work in there just because them low back muscles were so spasmed and so locked down.
Sure. Yeah, I know how that goes. And then like leading up to delivery, how did that go? We had some complications, so we had to get the medical doctors wanted to get Brock out of there 3 weeks early, and I think we were at like 19 days before the delivery date. How did that go for you?
Actually, and knock on wood, pregnancy went smooth. We went in, I think, about 2 weeks before her due date. No, it was a week before her due date. Just one last little checkup, and they did a couple procedures because they knew she was in a lot of pain to speed it along. Now they said there was no scientific backing from these procedures, but literally the next morning or 2 mornings later, we had the baby. She went in labor later that night. But
Awesome.
I said it was very smooth. Even some of the nurses and doctors were saying for a first time pregnancy, and I mean for how small her frame is, that like you couldn't ask for any better delivery.
Dude, we heard the same stuff. Obviously, as I mentioned, Tamara was induced medically or pharmaceutically, but
Right.
man, once the contractions started getting closer together, and once it really became time to deliver, it was just super smooth. And then Brock just shot right out.
Right.
But
Yeah, they actually one of the nurses that was in there, she went to labor around 6 p.m. the night before, and he was delivered around 3 a.m. the next morning. One
yeah,
of the nighttime nurses were saying that for her first pregnancy, she had chiropractic care, and she basically said, in layman terms, the baby walked out. Now the second two she didn't because she didn't have any coverage, and she was like she would recommend to every female to have some kind of care before. The first one's usually a little bit harder because it's the first delivery, and she said her first one was a cakewalk compared to the other ones.
yeah.
And she said she believes it was getting adjusted to make sure that pelvis, was right and the muscles were relaxed.
Absolutely, and it's obviously chiropractic. We're stimulating the central nervous system, and we don't. I don't think we know yet all the positive effects that we actually, yeah, exactly, that we actually bring to the patient. But man, and we've talked before a similar story about the PA, physical, what is that, physician's assistant that actually worked with us during or leading up to the delivery. She was telling us that chiropractic is great for pregnant mothers. She's seen a lot of benefits anecdotally herself. Obviously not a lot of scientific research behind that. But and no matter what this PA was telling us, I was going to go home and adjust Tamara, on a weekly basis probably anyways. So I'm glad that her and I were on the same page as far as treatments Tamara is getting at home. And then she said basically the same thing. She wasn't surprised when she saw how the delivery went,
Right.
knowing that I'm a chiropractor and obviously treating Tamara throughout the whole way.
Right, right. No, absolutely. I said it's nice when we can work together with PAs, doctors, and stuff like that.
Love it.
Yeah, it makes the world a lot better. Offers a lot more patient care, and like I said, a lot more knowledge too when people are working together.
Sure. And I think there probably is there might be some stepping on toes, but not a lot. And that's just because as chiropractors, I don't think we all believe we can treat everything, but it's probably, if you have something going on, it's probably a good idea to get a chiropractor's input on, course of treatment, because like I said before, we are going to start with that conservative care first, and then we go through the phases of care, as your symptoms progress or whatever it may be.
And I'll be the first one to admit there's sometimes a patient will walk in the office and I'll tell them, this isn't the route you should be heading. I'm sorry to say this, but it's either too far developed or this just isn't in my scope of practice. And I wish them the best, and I will find the best care for them. Whether it's a medical doctor, whether it's a specialist, whether it's even more natural care that I don't provide, I will do the best I can for a patient, because at the end of the day, that is why I got in this profession, to help people.
Awesome. No, that's really good. I'm proud of you for that. I don't know. I don't think that I've had too many experiences, just right off the bat saying someone else needs to go to a medical doctor. But I'd like to think that if that situation ever presented itself to me, that I would do just like you did. That's awesome.
Right, right. I've actually had three. First two were actually triple A's that
Oh, wow.
pretty, yeah. Like I said, low back pain that just wasn't what I was not comfortable treating, but like I said, that I wasn't the answer they needed. They needed further testing, and I'm
Sure.
trying to remember the second one. Something to do in the neck. It was either a congenital block or
Oh, yeah.
some kind of. Like I said, I can't remember what that one was, but it was. Like I said, it was pretty bad.
Okay. And then AAA, just for people that don't know, is abdominal aortic aneurysm. And you probably, what did you do? You took x-rays on those patients and saw.
Correct, and I could pick it up. I could pick it up on the lateral, the side view.
Right.
We do have a lot of training in reading X-rays, but that's also not my strong point. So the first thing I did is I sent it out to get it read by a radiologist.
Great.
I want their opinion. This is their expertise, and the DAC bar said absolutely. Further imaging. The other one says possibly could have been picking up a little bit of a side shadow too, but like I said, it's nice being able to lean on them too. They definitely know what they're talking about when it comes to reading images.
Sure. And then, like you said, you have a digital X-ray unit in office, so you saw that lateral lumbar film, and then we're like, okay, someone else needs to take a look at this.
Correct.
Yeah,
Correct.
that's right.
The nice thing is my boss was actually in office too, and he's been practicing for 18 years, and
Right.
I've showed him both of them, but he was like, I haven't got one in 18 years, and somehow you've gotten two in a year. He's like, I don't know if that's a good thing or a bad thing.
Right. No, that's a good thing, because you were obviously capable enough to handle the situation, and like I said, it's another reason why I'm proud of you, man. You've been
Appreciate
practicing.
it.
You've been practicing for a long time, though.
Yeah, I basically took a week off after graduation, and that was only to get board scores, and then it was basically jumped right into it. So
Man, that's great. And then
it is.
Go ahead.
No, go ahead.
Well, I was just gonna say, you took a week off. I probably took a year off practice, or a year off after we graduated, because Brock was brand new at that time, and then also it takes so long to open up a practice.
Like I said, my hat goes off to you for that. And I looked at opening up practices. One, the cash really wasn't there, and I honestly, the comfort level wasn't either. I said it's a scary venture. I mean, you are 100% on your own, but the the doctor I got in with has been amazing. It's actually got me into the profession. So
I wondered about that.
And a little side story since we're going off on it. Reason I got into chiropractic is I played sports through high school. Football, Saturday mornings I'd wake up, my neck would just be tight as can be. Well, I went to my medical doctor and got muscle relaxers and some anti-inflammatories. They worked, by Monday, Tuesday, I was good to go. Still had a little bit of soreness, but that Monday and Tuesday while I was at school and on the muscle relaxers, I just couldn't focus. I'm sitting there zoning, wanting to sleep.
Sure.
So the chiropractor I'm with now, my boss, comes in every Wednesday to the school and sees the athletes. Well, my dad was a big time fan of chiropractic, so I was like, we'll give it a try. First two adjustments, I won't lie to you, it didn't work at all. I honestly, there was a little bit more sore from him, but he was explaining that's the first time my neck's ever been moved like that.
Yeah.
He was like, if you think about it, he was like, we kind of link it to going back to the gym after a while. That first workout, about that second or third day, he was like, you're pretty sore. You're using muscles and you're moving stuff that hasn't been moved before. And I was like, hey, I can relate to that. So I think the third one, and I was seeing him in office too, just because it wasn't once a week. That third adjustment, like I literally felt like I could turn my neck again. I said in football, you're not supposed to use your helmet at all, but it happens. I said you got moving targets. A lot of times you know do put your head into someone, but that's basically what got me into it. I didn't have to take the pill anymore or pills, and an adjustment Wednesday morning or Wednesday afternoon before the game, and then it'd be Monday morning afterwards. And I mean, I was good. I was good to go.
Man, that's a great story. I wish I had one. Someone just asked me yesterday at church, or 2 days ago at church, they were like, "Did you get adjusted before you started chiropractic college? Is that why you did it?" And I said, "No." I was like, "Was it me and Max?" I was like, there were two of us out of maybe like 70,
Yeah,
70 or 80 students that hadn't been adjusted, on the first day of school."
I was wondering that too. I'm like, what are these guys doing here? Like, they've
No,
never been adjusted, but they're at chiropractic school.
right. That doesn't, I guess on the surface, that doesn't make a lot of sense. But, with my background, being in the Army, had some care go wrong that I felt like I should have been more involved in. I didn't have any control over my health care in the military. And then, so that kind of pushed me away from the medicine side of things right there. And then with my undergrad was exercise science at Southern Illinois University in Edwardsville. So I already knew basic anatomy, bones, muscles, ligaments, tendons. Knew a lot about joints, and then so I feel like that's really what pushed me over the edge
Mm-hmm.
to chiropractic.
Okay. I said that's yeah. I wish I would have a little bit more of that background. Like I said, coming in having no idea the anatomy was rough.
You did fine.
Um, well, I appreciate it. There was a lot of time spent studying, but yeah, I would say anyone going into this profession take under anatomy in undergrad. I don't care if it's not recommended. You will be way ahead of the class, and that is for sure.
Yeah,
I
because you
didn't
take.
realize,
Go ahead.
I didn't realize there was that many bones and ligaments in the body. I
No
got
kidding. No,
right.
you're exactly right. You have to have some. You have to have some form of anatomy training before you start chiropractic college, because once you get in, it's doctorate level anatomy.
Right. Oh, absolutely, absolutely. Like I said, I knew the big bones and the big muscles, but that was about it.
And then so anatomy is one that gets a lot of people. What about biochem?
Biochem, I had in undergrad, but it wasn't the biochem we had at chiropractic school. I promise you that. And I don't know if that was so much the teacher but like I said, those were totally different classes. I was excited because I did have previous exposure to it in undergrad, but yeah, a little bit lost in chiropractic school on biochem.
No kidding. And
Mm,
chemistry like math, which chemistry is a lot of math, is a universal language, right? So you would think
mhm.
every teacher would have to teach it the same, but no way,
Exactly.
no.
Exactly. Exactly. So the only thing that was really easy is biology. Like I said,
Yeah.
that transferred well over from undergrad to this, but that was 3 or 4 classes, so that really didn't help too much.
Well, within biology, there's that physiology. You know what I mean? Like, there's a fine line between those.
Right, right, and that's I mean, undergrad was mostly biology was not so much of human biology, but just kind of everything, animals, plants, and all that.
Right, life
Exactly.
processes and stuff. Yeah.
Hmm.
And then we had, so just thinking about the curriculum, the basic curriculum, we had some microbiology. We did, man, those labs killed me. I did not like those labs.
See, I didn't. That was all my undergrad was, or I shouldn't say all, but a lot of it. I even taught a couple of the lab classes there, so I didn't mind it. Of course, the 3 hours, I was like, there's a lot better things I could be doing in this time. But I mean, when it came to boards wasn't an issue with them classes, so they were definitely doing something right at school.
Yes, they were. And that actually, when someone asked me about being a chiropractic student the other day, they also asked about, what makes Logan a different school, because they had heard of Palmer. And I said,
Hmm.
well, Logan has really high board scores. Now, I guess I don't know where we stack up on that, but I have to think that we're pretty high, probably top 1, 2, or 3 schools for national board scores.
I agree. I said, and that's the hard line to walk is to teach stuff we need for boards, but also teach practice stuff. I think Logan does a decent job at that. Of course, like I said, we were ready for boards. Boards was not an issue for us.
Certainly.
but it's like I said, it's that hard thing to try to pass them, but also, hey, we need to learn to go to practice, start a practice, join a practice. So,
Yeah,
I said
because
I
go
would
ahead.
like to see what the other schools do to try to balance that out, because I don't think there is enough time. We spend a lot of time at school. I don't know if you can spend any more time.
Because there's two things going on there. You have to uh, during the curriculum, you have to be able to maintain a high level of practical knowledge,
Mm-hmm.
which is sometimes a lot different from the hard science, the textbook
Mm-hmm.
science. Isn't that interesting?
Absolutely. Yeah. I mean, you come out of school and you're talking, all these big words and stuff like that, and you get out to the real world that aren't, your classmates and don't understand them, and they'll say
Sure.
subluxation or even like AAA. Like I said earlier, I didn't really explain it, and that's the stuff that you have to almost kind of step back a little bit
Yeah.
and dumb it down a little bit because, like I said, you have to be able to explain to the patients what's going on. You can't use the big words.
Yeah, and dumb it down. I don't think that's an offensive term or anything like that because, we're not really questioning anyone's intelligence. We're just basically
Mm-hmm.
saying we can speak on this topic at a very high level, or we could bring it down a little bit to where
Right.
a larger group of people can understand it who don't have to have
Right.
that specific education.
Right, right. I said some of the words we learned at school, I don't even like saying they're too long. They're too long and too big.
No kidding. Yeah, I see spondylosis all the time when I'm doing research, and I'm like, I never even use that word once in
No,
practice.
no, no.
Just degeneration, basically.
Exactly, exactly. It's a lot easier, first of all, to say, and patients understand that.
Yeah.
Basically, AKAs of each other, but you say degeneration to an average person, they know what that is. You say spondylosis, they're like, I have no idea what that is.
Right. It's almost like spondylosis is a radiology finding. You know what I mean?
Right, right, absolutely.
Or diagnostic imaging finding, and then degeneration is like patient talk.
Right,
And
right.
so I guess a good way to explain degeneration for people that don't have a sharp definition is just that it's the aging of a joint or tissues faster than the normal aging of the rest of your body.
Mhm.
So wear and tear, basically.
Right, and I tell you, one of the biggest things I like to reassure patients when they come in. We're talking a middle-aged person, middle to older age, and they'll come in and we'll be going through their initial exam. They'll be like, "Well, I have degeneration. I have arthritis and stuff like this." And I tell them, that's yes, but no. I said anyone over the age of 30 is going to have some kind of degeneration somewhere in their body. That means you've lived an active lifestyle. That means you haven't been sitting around a lot. Now, there's things we can do to slow down that degeneration. Nutrition, exercise, hydration, supplementation. Some of the biggest things you can do to slow down that degeneration. Take care of yourself. But there's also some people that are predisposed to it that have a lot more than they should at that age. But if you're over the age of 35, you probably have some sort of degeneration, some sort of wear and tear in the body. It's at least that's a natural aging process.
No question. And then for people like us, we're both, or at least I like to think I'm athletic. You're probably more of an athlete than I am. But definitely, right arm dominant, overhead thrower type of athlete. And so I don't think there's any question that both of our shoulders, if imaged, would probably have some sort of,
Oh,
degenerative finding.
absolutely, absolutely. Like I said, that's you can look at stuff you do. Like I said, sports is a big thing, or even just a job. You get some kind of manufacturing job where you're using that right side the entire time.
Yeah.
It's just like sports.
Yeah. And then when a patient tells me, like, if I get a patient in the office and we're talking about their issues, going over a detailed history, and someone says, "Oh, I know I have arthritis of my low back, of my lumbar spine," I try not to smile because inside I'm actually smiling because I know these people have a problem, and I know that they know they have a problem. They know they need to fix their motion. They know that degeneration probably comes from not moving that area of the spine or body well. And
Right,
so
right.
that gives me an opportunity to kind of intervene as far as movement goes, which I really love. And
Hmm.
then, and like I said, I try and hide my smile, but I am happy that the patient knows they have an issue that needs to be
Right,
corrected.
right, right. And like I said, that's awesome. When a patient comes in and not knowing the stuff but is aware of their body, is a lot better than the patient who's not. I tell people all the time that I would rather you be out injuring yourself, working in the yard, playing sports. I can fix people that are active. People that are sitting at home aching. You can't retrain them, or you can't train them as well.
Right. And we see. I'm sure there's. I'm sure we find degeneration in most of our patients, but there are those patients that don't have a lot going on, and they just want to come in for maintenance or wellness type
Mm-hmm.
of adjustments, which is great. But
Mm-hmm.
I almost find those patients more difficult, to get 100% patient satisfaction out of versus
Right.
someone who already knows they have an existing condition like very mild degeneration that is in a significant amount of pain. They go through a small trial of care, maybe 3, 4, 5 visits, something like that, and they are just 100% better. I
Right.
really I
Right.
really enjoy working with those patients.
Which I think a lot of people that are on self-diagnosed maintenance, if that makes sense,
Yeah.
are okay with the everyday aches and pains. Which in there's times that that's acceptable. But I tell people when they come in, especially during the initial interviews, and I'll be like, how do you describe this? It's sharp, dull, achy. Is it going down the arm and all? And they'll say, well, it's my normal pain. We shouldn't have normal pain. You may have daily pain, but that's not normal. So let's figure out what's causing this pain, and let's get you better.
Yes. No, you're not supposed to have the same pain day after day after day.
Right.
It's okay to
Yeah.
notice pain, in different areas because obviously your body's full of sensation, receptors and things like that. Went way too far.
Right.
But yeah, it's okay to notice, different types of pains throughout the day or on a daily basis. But if you're noticing the same pain every day,
Hmm.
please come see a practitioner like me and Dr. Murtland.
Right. I mean, that's your body sending you a signal. Hey, something is going on, and it's not. If your back aches after a long day of yard work, that's understandable. We probably didn't have the best position. You're doing hard work, but if you were at home most of the day and you're waking up each morning, with low back pain, low back tightness, there's something going on there. I'll tell you a lot of things I've actually recommended to other people is mattresses. Think about it. You're spending anywhere from 5 to hopefully 8, 9 hours.
Yeah, right.
This course pre-children in that bed, so you better make sure it's comfortable.
Yeah.
And I understand mattresses are expensive, so it's flipping them, rotating them, mattress tops. But that's you don't take care of your body while it's resting, trying to rebuild itself. You can't expect for it to be good during the day when you're actually using
No kidding.
it. Hmm.
And then can we talk about how being a dad helps with practice?
Absolutely. I tell you, being a dad has been a shock. I used to tell myself I wasn't ready, and I realized very, very shortly that I'll never be ready. There's no way you can get used to that, 3 a.m. wake up call that you can't hit the snooze button on. Yeah, I tell you, it's slowed me down a little bit. Taking a little bit deeper look into what's going on. Said I really can't explain why or how. I said it's definitely just it's changed your outlook on life a little bit. When you go from your partner, your wife, your spouse is number one to now you or her are no longer number one and this kid's number one. Like I said, it just complete 180 has changed me around. But it's been an amazing experience. Healthy as can be. I think
Good.
the good Lord upstairs. I mean, that's at the end of the day, that's all that matters. As long as he's healthy, everything else will work itself out. So, what
And
about
then,
you?
well, I want to hear about how you adjust Nico.
Um, I won't lie. When he first came out, I said we did a natural, vaginal delivery. He was unable to turn his head to the left side a little bit. Now I've been treating children since I started practice. My youngest one was about 6 hours old.
Oh wow.
Yeah. And then I was a little nervous to adjust my own child. Now, when we talk about adjustments of children, it's a lot different than adjustments of adults. A lot of people become very, weary and scared when we're adjusting children. But what I try to tell the mom or the dad is it's like the pressure you'd put on a tomato without wanting to bust the skin. Like I said, there's no rotation in the neck or anything like that, and it's very light. And I mean, when we're doing, I don't know how many children you've adjusted, especially in the neck, but I mean, it literally just melts back in like butter. A little pressure, toggle on it like this, and it just goes back in.
Hmm.
So I think I adjusted him for the first time. I think it was this third day because we were at home. the whole hospital scene was just a little much for me. It wasn't much sleep. I was aching and stuff like that from sleeping on that a little couch. But biggest thing for him is basic. He goes to the bathroom about every 2.5 or 3 days in the morning. I mean, he's on a set schedule. If we get to that fourth day, we know he's a little bit constipated. So there's a technique we're taught at school. It's basically I'll have him laying face down, and there's a ligament down on the inner thigh, more towards the posterior, where kind of controls all the muscles in the lower half.
Sacrotuberous, right? I forget.
Yeah,
Yeah.
correct. Yeah, I couldn't remember the name of it. And with the pressure on there, I hold both sides for 4 to 5 minutes. Now it's a light pressure.
Yeah.
There's some times where he'll squirm and stuff like that, but I usually try to have a nipper in his mouth so he's entertained. But I have maybe a minute sometimes afterwards to get that diaper on him, or it's gonna be a mess. But it's like I said, you can just tell when that pressure's going how much better he feels.
Sure. No, that's really cool. As far as Brock goes, man, when he was first born, I didn't adjust him at all. It probably took me a month or two to really adjust him. And then, like you said, the light pressure, the toggles for cervical spine, I didn't actually try and crack his neck, obviously.
Right.
But I did adjust his thoracic spine, his upper back, and his mid back.
Okay.
I did get some, some pops in there, which is not necessarily what I'm looking for, but I did kind of crack his upper back, and he would always smile. There was probably a few times where I just and I actually used Brock, to learn, because I didn't have any practice with infants. Of course, I had held an infant before, and I don't have a really strong nurturing side, but it started to come out with Brock, and so so I guess
so there is a softie deep down inside
somewhere. Yeah, he comes out once in a while. Yes, but yeah, no, working with Brock was a lot of fun. Now I adjust him whenever I get my hands on him. Really, I just if I find something that sticks a little bit, with his hip or his, like I said, thoracic spine. I certainly try and help him with that, and he's all smiles usually, but it's actually hard to get him down in a still position. He's all over the place.
Right. And I will tell you, now that he's moving and walking and stuff like that, he's going to have a million falls. So now it's huge for adjustments. He's going to be jamming stuff, running his head into things. So now is the time that adjustments are going to be huge, making sure that spine is properly aligned.
Good. And like I said, it really has helped me with my practice. I guess I haven't had too many babies come in recently, but I'm ready.
Right.
After going through that first year with Brock, I feel like I know maybe not everything, but I know most things. I know what to expect, and I know how to adjust a baby.
Which in theory, a baby's spine is just like ours. It just takes a lot less pressure.
Right.
A lot less pressure, but they need it just as much as we do. The goal would be to have to treat them from birth, which, like I said, a lot of people have that fear of getting their baby adjusted because they've seen either adjustments online or they've seen they've been adjusted themselves. But like I said, I try to tell them, I said, go on YouTube, type in baby adjustment. You'll either see, or infant adjustment. You'll either see them using very light pressure or the activator.
Yeah.
Now the activator scares them at first, and what the activator is, a little tool, looks like a little handheld like gun almost. And it's just a real quick impulse. You're able to adjust it deep to light pressure, but like I said, it's once the parents see that, I think they're like, okay, it's not the twist in the neck, it's not the big time drop where you got table pieces going down and stuff like that.
Right, and I like the activator. I forgot that I did use that on him because I was scared to try and adjust his neck, so I did use the activator.
Right.
And what that is just like you said, it almost looks like a little handheld finger gun. And basically, it's just, it makes a click. But what that does is it's really quick. The speed is what's important. As if we're talking about the central nervous system and, nerves in general, speed is what really makes a difference. And so that's what the activator brings. A much lighter force technique, but very quick.
Right. And very specific, too.
Yes.
Their spines are little as can be. My hands are decent size. So sometimes that activator, when I need a specific impulse, is a lot better than that.
Sure. And like you said, the baby spine is just like ours, just like adults. Now it's not fully ossified yet, but where there should be bone, there's cartilage. There's still joints, is what I'm getting
Right.
at. There's still rudimentary discs. There's still joints forming and growing in there, and so those need to move, and they need to move well.
Like, listen, I'll tell you straight up, if there's a patient I can't help and they need further, I'll send them down the road. I'm not going to waste their time. But like I said, I would like to be the first line of, treatment if possible.
Primary care, dude, that's where it's at because
Right.
we are conservative care, so it makes sense that people need to try that first.
Right. Right. Yeah, because I try to tell patients this too. I said, if this doesn't work, nothing's hurt. Nothing went into you. Nothing was taken out of you. And I'll be the first one to tell you, hey, I don't think this is the route you need to go. I think we need to send you down the road to someone else. And like I said, it's not swallowing my pride or anything. It's just the honest truth. I'm not going to waste their time.
And I like how you said what you said about if your stuff isn't working or if your treatment isn't working because, after so I do treat people on the first visit, and then I expect them to have some form of relief when I see them on the follow-up, whether that be in a week or just a few days. But I'd certainly expect some form of relief. And then I'll probably start branching out if patients don't get better off that first visit.
Hmm.
I mean, you're probably
Yeah,
like,
I
go
find
ahead.
it. I find it hard not to adjust on the first visit. Now, there's sometimes if I can't view the X-rays that quick, we did purchase a digital unit here, which helps. You know what I'm saying? You don't got to go in a dark room.
I
Digital's pretty
bet
quick, but
that's awesome.
I find I find it very hard to relieve or to not cause some kind of relief in the area. Light adjustment, even a little bit of soft tissue work, but give them something, some kind of relief. I mean, I know what neck pain's like. I know what back pain's like. I mean, you want treatment now. You want to feel better now. And that's the reason they're coming to me.
Exactly. And you're a nice guy. I like to think I'm a nice guy. If someone came in and they were in, 8, 9 out of 10 on the pain scale, you know what I mean? Like I feel like I need to
Right.
do something that day.
Right. Absolutely. Absolutely.
Dude, Dr. Murtland, I had a blast talking with you, man. I actually learned a lot.
Well, good, good. Yeah, definitely. I said I like the sports rehab part of your practice. That eventually is going to come.
Yeah.
I'm hoping in about 3 to 4 years to be in a new space that allows that a little bit more. But yeah, I mean, retraining, re-education of the body is huge, especially as we're aging and to slow down aging a little bit. But yeah, I appreciate the time. We should definitely do this again, and I'm interested to see the video once it's up and running.
I couldn't have said that better myself about sports rehab. That was awesome, by the way. And yes, my pleasure, dude. We'll do it again soon.
Sounds good, bud. Have a good one.
You too.